Hey everyone, it's Amani there. For this vlog, I interviewed Ms. Campbell, who is a counselor at Bennett College, and we discussed some counseling services that the family can go to or partake in once their family member is diagnosed with dementia or Alzheimer's. Hope you guys enjoy.
My name is Robin Campbell, and I'm Director of Counseling Services here at Bennett College.
Okay. Ms. Campbell, are you aware of what dementia and Alzheimer's is?
Yes, I am.
Okay. Have you ever dealt with a patient with Alzheimer's or dementia?
Yes, I have. Before working at a college campus, I used to work in a mental health hospital. And so sometimes we would have patients come in to the inpatient unit, elderly patients that were dealing with Alzheimer's or dementia. So my role as a counselor would be in the initial stages of getting the patient admitted to the unit.
Okay. And were you aware of how the family were affected? Well, how did they respond to the diagnosis of the patient?
Well, of course, anytime you have a family member that is diagnosed with Alzheimer's or dementia, it's really an adjustment, I would say, for the family. And it's hard because, as we all know, it is a progression. The disease progresses and gets worse. So as far as family members, it usually is a big adjustment for them. And at that time, I would suggest that they get connected to services that would support them as they make plans for their loved one.
Now, who in the family do you believe that needs the most support?
I think it's going to really depend on the person that's going to be doing the caregiving, whoever that primary person would be that is going to be responsible, say, for instance, for medication, taking them to appointments and things like that. So I would say whoever that person is that's going to be doing the majority of the caregiving. But it would also be wise for additional family members to be a part of that process too, just because caregiving can weigh a lot on that one person, and it can create, depression and an adjustment as well in dealing with it on their own. So I think it should be a family effort in assisting the person that has the disease.
Okay. Now, can you talk about the effects of being a caretaker?
Being a caretaker can have a big toll on a person, simply because their loved one is going through a transition and dealing with the disease. So it could be like kind of a heavy burden. So the caretaker needs to make sure that they take care of themselves. Because when you have to take care of someone else that has the disease, you have to make sure that you're caring for yourself on the other end. So I think it's very, very important to get family involved, to get support systems like being a part of a support group, maybe church family, extended family, and neighbors that you feel that you can trust or confide in, and not try to do it all by yourself. Because if you try to do it all by yourself, that's going to create more stress. So my recommendation would be to always extend your network of support and community to help you in caring for the person with Alzheimer's or dementia.
Okay, thank you so much, Ms. Campbell.
You're welcome. Thank you.